This is Dora. She's here today for a bladder scan and then a sterile cystocentesis, which is a sterile needle into the bladder to get a sterile sample of urine to send off to the lab to just check for any infections, any bugs, anything that could be in the bladder that's causing Dora problems. So we can actually see something inside the bladder. I'm not too sure what this could be. It looks some kind of soft tissue formation. So the next steps would be to do surgery, possibly a cystotomy, and have a look inside the bladder surgically. So today we've got Dora back in for her cystotomy surgery. So we're going to do some surgery to look at her bladder, find out what is in there, and potentially remove anything that is causing her problems. She's now asleep under anaesthetic. We've just taken some bloods to test for a pre-anaesthetic blood profile, which checks her organ function and her clotting levels, red blood cells, etc., just to make sure that she's all okay for the surgery. Also, being an older girl, she's 7 years, so it's really important that we do this blood panel just to make sure that everything's okay.
So basically what we've done here is a cystotomy. So Dr. Luca had scanned this bladder and found out that there was a little tumor in the bladder. From the scan, it was unclear whether it was a tumor or whether it was a blood clot. So we've gone in today and I removed the tumor from the bladder. This is then going to be sent off to the lab for histopathology. They're going to analyze the tumor and see what type of mass it is. The most common types of masses that occur in dogs' bladders are something called transitional cell carcinomas, or TCCs, and those generally occur at the neck of the bladder. However, this one was at the apex of the bladder. So having a tumor at the apex of the bladder is actually a much better location for the dog, because you can actually remove the tumor and remove a little bit of the bladder without causing too much long-term side effects for the dog. So currently I am just stitching up the bladder. This is going to be done in 2 layers. So my first layer of sutures is going to run across here, and then I'm going to do an inverting pattern of sutures across the top of the bladder to just pull everything together nicely, and then we'll be closing her up.
We're just off to a visit. We're going to Sittingbourne to do a health check on a 75-kilo wolfhound and also administer a supraloring implant.
We're very proud to be offering this essential ambulance out-call service. We understand that many emergencies will need an out-call service. We understand that many people don't drive, and we understand that there's some pets that don't do well on journeys. So we will come to you. That's a promise. Please feel free to call the Noah's Ark team today. Please feel free to call the Noah's Ark team for any type of support that you might need. We have a state-of-the-art facility set in 55 acres. We also have paddocks that clients can use for running their dogs. And due to our historic ability to handle the more powerful working dogs, we specialize in that aspect.